Good morning. I'm LaShondra Shaw, PIO for the City of Austin, and I am the moderator for today's news conference. Spanish interpretation of this media availability is on ATXN 3. To start, Austin Public Health Director Stephanie Hayden will first say a few words, followed by Dr. Mark Escott, Interim Austin Travis County Health Authority, then Janet Pichette, Austin Public Health Chief Epidemiologist, followed by Cassandra De Leon, Interim APH Assistant Director, Disease Prevention Health Promotion Division. We will then open it up to our pool reporter, who will ask questions on behalf of the media. Stephanie, over to you.
Good morning. We want to start by talking about how you and your family can be safe for the holiday season. My hope is that you have already planned your new tradition of how you and your family will share over the holidays. Our hope is that we know that the vaccine has started arriving in our community, and it's going to be so important for us to be patient as the vaccine arrives. In the meantime, it's so important for us to continue to watch your distance, wear your mask, wash your hands, stay home if you're not feeling well, and please reach out and take a test at either one of the testing locations or through your primary care physician. When you're thinking about errands that you have to run that are essential errands, it's going to be important for you to designate one person from your household. It is so important as you designate that one person, you think about all of the other conditions as well. My hope is that you would identify a person that is under 65 years of age and doesn't have underlying health conditions. That is going to be important for us as we move forward to flatten the curve. At this time, I'll turn it over to Dr. Escott.
Good morning. Unfortunately, our cases continue to rise in Travis County. Those numbers are up 86% since the beginning of this month. It also seems apparent that this week, COVID-19 will become the third leading cause of death in Travis County for 2020. Today, we're at 516 deaths. When we hit 517, it will put us, it will surpass accidental death as that third leading cause. That's an important reminder that as the vaccine arrives, as the hope increases with vaccine coming to our community, that we dig deep and that we ultimately provide a gift to other people. This is the gift-giving time of year, and the best gift that we can give this Christmas is masking and distancing and staying home if we can. There are so many people out there who are suffering this Christmas season because of this virus, and we are in control of the ability to decrease that risk, decrease that threat through simple actions: masking, distancing, washing our hands, staying home when we're sick. We have an opportunity to decrease disease here, to create an opportunity for others to get the vaccine later this winter and into the spring. And it's important that all of us work together to flatten the curve again in Travis County and save as many lives as we can. And with that, I will pass it over to Janet Pichette.
Good morning and happy holidays. Just to kind of add on to what both Dr. Escott and Director Hayden have said, it's very important. We know that people are going to celebrate the holiday seasons, and we really do not want to see a repeat of the Thanksgiving holidays where we had massive spikes following family gatherings in those situations. Again, we have seen over and over people who participated in family gatherings during the holidays, and it affected the entire family, and God forbid that it would affect somebody who's at high risk for COVID-19 And we just want to make sure that everybody has a happy and safe holiday. Again, our prevention measures are critical. You need to wear a mask, you need to socially distance, and you need to stay home if you're sick. Even if you have mild symptoms, you need to assume that you have COVID-19 if you have not been tested. And finally, you know, I'm going to, again, I said this before during the Thanksgiving holidays, but we really need to exercise some personal responsibility. So like Director Hayden said, if you have to go out to the grocery store, it's going to be critical for you to designate one person to do that shopping for you, not take the entire family out for that event. If you have essential activities that need to be done, it needs to be done by that designated person. And we need to exercise personal responsibility. So if you are placed in a situation where there could be somebody at risk near you, you need to make sure that you are socially distancing yourself from them. And if they're not wearing a mask, you need to make sure that you have one on to protect both them and yourself. So again, I hope everybody has a very happy holiday and make it a safe holiday as well. Thank you.
And good morning. We are excited to note that we have a new allocation of vaccine for this week that is starting to roll out. It does increase that capacity that we initially had last week with that 13,000, and now we're seeing an increase of over 20,000 new vaccine coming into community, which includes the new Moderna vaccine. With that being said, we know that we've been directed by the Department of State Health Services to allocate that vaccine to that phase 1A group, which is still the healthcare providers, those that are providing direct care, particularly for COVID patients, and those that are at high risk for COVID-19 severe disease. That being said, it's so important that we continue to do that social distancing, masking, all of the tools that Dr. Escott and Stephanie and Janet have discussed. The importance of taking this time to take care of each other and just being patient about vaccine. It's coming. We are excited that right now we've seen additional providers that have willingly signed up, and they will be able to have that experience of providing vaccine through this week. So that just gives our infrastructure more capacity as more vaccine comes online. So right now, think about where you might want to get vaccine, where are those access points that we're seeing starting to come online in our community, but continue to stay safe, continue to practice those measures so that next year we can have our celebrations with all of our loved ones at the table.
Thank you. Now we'll turn it over to our pool reporter, Ashley Lopez from KUT. Ashley?
Thank you very much. So our first question is, Austin is getting closer to reaching the rolling average for stage 5 restrictions. Do you anticipate the city will move into those restrictions as people plan to celebrate the Christmas holiday this week?
Well, we're of course still monitoring the data. We hit 50 at the end of last week. Over the weekend, the admissions numbers decreased a little bit, as we have seen typically over the weekend. I expect today that we're going to be up at 50 again. And looking at the data from last week, 2 weeks ago, our positivity rate in the community was 8.9%. Last week so far, positivity is 8.7%, so roughly the same. So what we may see this week of Christmas is similar to what we saw during Thanksgiving. I think we're going to see some flattening and maybe a slight decrease. But really, regardless of if we're in stage 5 or stage 4 this Christmas week, it's important to know that we still have to decrease our risk, decrease our personal risk, decrease the risk for our household, and decrease the risk for our community. And that means, dialing back the risk a bit. That means staying home if we can, certainly staying home if we're sick, and avoiding gatherings outside of your household. As Janet said earlier, we saw case after case after case related to Thanksgiving gatherings, and one individual in the family introducing COVID-19 to the entire rest of the family. We simply cannot have another episode like we did over Thanksgiving, because we're already at 50. And if we have another, super spreading event, Christmas or New Year's or both, it could trigger off a devastating surge like was seen in El Paso. It's really up to all of us to take note of that and realize that if there are activities where masking and distancing aren't possible, those are things we shouldn't be doing right now.
The next question is from KXAN. Approximately how close are we to getting all healthcare providers in the Austin area vaccinated?
Well, we received almost 14,000 vaccines the first week. This week, a little over 20,000. We've got somewhere in the neighborhood of 80,000 healthcare workers in Travis County. So we don't yet have enough to vaccinate the healthcare workers. And, again, we're all going to have to be patient when it comes to the rollout process. There are individuals in this community, based on the nature of their work as a healthcare worker, as a nursing home staff member, as a first responder, that have been prioritized in order to secure that healthcare infrastructure. The other thing that we know from our data is that people who are older are at substantially higher risk for severe disease and death. 85 or 82% of our deaths are in individuals over the age of 60 in Travis County. 94% of individuals who've died from COVID-19 are over the age of 50. So there's a clear relationship between age and risk of severe disease and death. Same is true for hospitalizations in those age groups. We also know that our communities of color, our African American community, our Latinx community, our Native American community are at substantially higher risk for hospitalization and death than the rest of the community. So it's important that we understand that it's going to take time to get people vaccinated, to offer vaccine to the community, but we will do so in an evidence-based fashion.
One other thing I'd like to add is that as we are being patient, because we know we don't have enough vaccine to cover all of the identified populations, we're going to have to continue to wear our mask, watch our distance, and definitely stay home if you're ill, and wash your hands often. Those things we're not going to be able to stop at this time. So even with the individuals that have received the vaccine, everyone has to continue with these health practices.
This next question comes from Fox 7. With the latest announcement that teachers and other essential frontline workers, such as police and firefighters, are next in line for the vaccine, what are your thoughts on the decision? How will we see that play out here in Travis County?
Again, there's different ways to think about vaccine administration. It's clear that we need to prioritize our healthcare workers, our hospital workers, because we have them in limited supply and we need them to care for the rest of us. Again, it's also clear that the populations I just mentioned, those who are over the age of 60, those who have underlying health conditions, those who have the highest risk of severe disease, which includes prioritization of our communities of color, are an essential component of that strategy. There are other groups that are at higher risk for being exposed to the disease. That would include groups like our first responders who have to work despite these protections. I will say that when we look at schools, when we look at other job activities, while early on there was a significantly increased risk of transmission in those groups, the protections that have been put in place, the masking and the distancing, the plexiglass that you see in places like grocery stores, and service counters have done a great job. So it's really about balancing the risk of severe disease versus the risk of exposure and how we perform the allocation from here.
And I like to just add that, Austin Public Health is a provider, just like there are many providers that will be responsible for distributing vaccine within the community. We tend to serve the safety net groups, the uninsured population and high-risk population. I will say that we are continuing to work with the state health department and the state of Texas, following the guidance that they provide us on what those prioritization groups are, especially for the phase 1A and phase 1B populations. So again, we continue to take their lead and follow their guidance that they provide us related to vaccine distribution.
This next question comes from Community Impact. If Travis County moves into stage 5, what suggestions would you have for local school districts regarding the return to class after holiday break?
So if we are in stage 5, when the schools start up again, what we've asked the superintendents to do, first off, is to scale back or eliminate extracurricular activities. That's because that's where we're seeing spread in schools is the athletics programs, the dance, cheerleading, and other extracurricular activities where social distancing and masking aren't possible or practical. In the absence of being able to eliminate those, we have recommended that a proactive testing program be implemented in those activities that do continue. If things get worse, if there's ongoing increases in cases and hospitalizations, despite the scaling back of extracurricular activities, we look at transition to virtual for places like high schools, followed by middle schools, with the preference of protecting the in-person activities of elementary schools as long as we can. We know that transmission amongst elementary age students is very low. And again, the schools have done a great job at decreasing transmission through those policies and procedures that they've implemented. So our hope is to at all costs, keep our elementary schools open as long as we can.
The next question is from Co-op Radio. Dr. Escott stated that we face unprecedented levels of cases and deaths through January if discipline is not restored during these coming holidays. With resource capacity already shrinking, how will hospitals decide who will get the available beds, ventilators, and care?
We do have a task force that's reviewing guidance for, in the event that we have to ration care. I don't anticipate that happening soon, but that is one of the things that we've had to start up again as our cases continue to rise. We don't want to have to be in that situation where we have to make decisions regarding who gets care and who doesn't. But that is the reality of an overwhelming surge. And, I think it's up to us as individuals in this community to avoid that possibility by taking the simple steps of wearing a mask and distancing and washing our hands. And most importantly, staying home when we're sick and getting tested.
The next question is from KView. We're seeing record-breaking numbers of travelers nationally, which are topping the numbers of flyers we saw in November. People are traveling this holiday regardless of what health officials are recommending. What are the safe ways to travel if someone chooses to do so?
Well, I'll start, and the others may want to add on, but our best advice is to stay home and don't travel. We don't want to see a repeat of what we saw at Thanksgiving, particularly not when our cases are as high as they are right now. But if people choose to travel despite that advice, it's better to travel by car with people from your household versus air travel. If they're going to travel by airplane, double masking is going to add additional layers of protection between you and other individuals on the airplane. Strict attention to hand hygiene is also a critical factor. So bring your hand sanitizer, hand sanitize often. You can wipe down your tray on the airplane and the surfaces that you're going to touch as well. But again, it's we've got to realize that we are in an unprecedented place, not only in Travis County, but in the state of Texas and across the United States. And at a time when we have vaccine available, we have the ability to protect folks with 95% certainty and probably close to 100% certainty from severe disease. It's really important that we wait until we can get more vaccine out there to protect this community before we choose to gather with people outside our household.
And I would just like to add, if you do decide to travel, you should consider having a viral test taken 1 to 3 days prior to your departure. And upon return to your home, you should consider restricting yourself or placing yourself into self-quarantine for a 7-day period and avoid all non-essential activities. And then also follow up with a viral test for COVID-19.
The next question is from patch.com. What is the amount of administrative fees charged for coronavirus tests, and are the uninsured assessed these charges?
So the testing in Travis County is available free of charge through Austin Public Health. Folks can access that at austintexas.gov/COVID-19. And they do a self-assessment. We have drive-through testing. We have at-home testing for folks who can't make it out of their house. We have neighborhood testing. The testing through community care is free. And there are other private entities like Curative who also offer free testing in this community. There are a variety of other tests available through private physicians groups or private testing centers. And folks need to check with them before they schedule a test to determine if there are any fees associated with that. But from the Austin Public Health side, absolutely no fees.
And I just would like to reiterate, if you are in need of a test, if you're exhibiting symptoms, if you've had an exposure, if you're, as Janet was saying, if you're looking to travel, we highly encourage testing. We encourage testing in any of those kind of scenarios. If you work in a high-risk situation, any of those things are a good reason to get testing. So consider those needs, and there is testing resource available. If you don't have resources, please look at City of Austin test sites as an option, and there are other options as well that are free, and there should be no barrier for you to access testing.
This is the second round of questions from KUT. How are local health officials identifying essential workforces to vaccinate ahead of others? For example, local construction workers were an early COVID-19 hotspot. Are workers like these going to be near the top of the list for vaccinations?
Again, our focus is based upon the data we have, and our focus will be on identifying those who are at the highest risk for severe disease first. We still have to get through our healthcare workers, and then we have to get through our nursing home workers and nursing home residents. You know, essential workers are further down on the list of priorities. But we certainly recognize that, you know, many of them are amongst the populations that I mentioned earlier, either because of age or because of race or ethnicity. So we are working with our community partners through a large task force associated with vaccine administration to ensure that we can appropriately identify folks and ensure that we have appropriate conversations and transparency with the community so they know when their time has arrived to receive the vaccine.
And I'd like to add, for those essential workers, as we move through the phases, noting that there are so many different providers that are going to have vaccine available, that really gives a lot of choice for individuals, for workplaces, for people who are at risk, to identify what place for accessing vaccine best meets their personal needs. And this is the time to be thinking about that as vaccine starts to become more and more available in our community. So please look at what's available, be thinking about what do you need, where would you be most comfortable in accessing vaccine, and pay attention to what providers are offering vaccine at this time. And as we keep getting additional vaccine, what providers are available.
I would also like to add that the department works very closely with the Texas Department of State Health Services. And they are the lead to determine, you know, which areas, which priorities will be set as far as essential workers are concerned. We are definitely, you know, Austin Public Health as a safety net provider will continue to have our focus of people of color, low-income individuals, but we will also focus on individuals that are not insured. And so it is so important, you know, as we move forward, you know, I know this is going to continue to be a process where all of us are going to have to exercise more patience. But as we get more vaccine into our community, as all of the additional providers are stood up, there will be options of where individuals will be able to receive the vaccine in our community.
The next question is from KXAN. Last week, Governor Abbott said there will be no more closures in Texas and that we need to focus on reopening businesses, pointing out that California is seeing a record spike in cases despite its tight restrictions. Do you agree with this approach in Texas as cases surge?
Let me say that, you know, I appreciate the governor and most importantly, I appreciate the mask mandate that he put in place across the state of Texas this summer. I'll say that, you know, I've been out. I went out this weekend to get a tire fixed and saw lots of folks not wearing masks. Lots of folks not convinced that they work. I think if we do what we need to do, if we follow the state law and wear our masks and distance, then I don't think it's necessary to close businesses again. From the beginning, Austin Public Health, our city and our county have focused on finding that balance between public health and economic health. And we've been in a sweet spot for quite some time. But what we're seeing now is that we're out of balance. And right now we're seeing that public health is suffering as the cases rise, as hospitalization rise, as deaths rise. So it is important that at a time like this, we reassess how we can dial things back, put things back into balance. Ultimately, if people become more vigilant about masking and distancing and only going out for things that they need to, only sending one person to the grocery store from the family, for instance, then we won't need to have things like closures or even a curfew. But it is up to all of us. We can't do it alone as city and county government. We need our community to respond as they have in the past and help us flatten the curve.
This next question is from Fox 7. When, if they are, will the numbers from a surge from the holidays be seen? If a major surge or spike is to come from gatherings and people traveling, is the county and hospitals prepared?
The county and the hospitals are prepared, but again, there's a finite number of staff. There's space, we have equipment. Where we're going to struggle is the people. We can't make more nurses and more doctors and more techs and more paramedics quickly. So that will be what limits us. We are concerned, particularly by the fact that Dallas and Fort Worth are surging and their hospitalizations are well over 15% now. San Antonio is almost at 15% of their hospitalizations taken up by COVID-19. Houston is surging, and now we're surging as well. So as the major metropolitan areas across Texas all surge around the same time, we can imagine that resources are going to be deployed to Dallas and Fort Worth, to San Antonio, to Houston. We're fourth in line right now, and my concern is that those resources may not be there at the time that we need it. So again, we have to decrease the risk. When are we going to see that surge happen, and to what extent? We're probably talking about the first to second week of January. I'm sorry. So usually we see the cases rise the week after the event, and we've got a 1-2 punch with Christmas and New Year's coming. So by the 7th or 8th of January, we can expect to see the impact on cases, and the following week, the impact on the hospitalizations, ICUs, and then further down the road, another 2 or 3 weeks on deaths.
And I'll just reiterate what Dr. Escott said. Following the Thanksgiving holidays, we saw a surge in cases, I'm going to say between 5 to 7 days after the event, by the time we started receiving more cases. People are probably likely going to experience illness if they're exposed in those events between 3 and 5 days afterwards. And then, we're still seeing the effect of secondary surges related to people who were exposed to people who attended something. So I'm going to say about a week out is when we saw it for Thanksgiving. And also we saw the same phenomenon during Memorial Day and 4th of July holidays as well. So we're preparing here with our case investigation from that aspect and that angle. We have people who will be working over the holidays to enter cases because we are seeing an unprecedented number of cases on a daily basis as we're going forward. Again, I can only stress, as we've been saying this since last March, to make sure that you are doing those prevention activities. If you can't hold somebody else accountable for what they're doing, hold yourself accountable so that you keep your family safe during this holiday season.
The next question is from Co-op Radio. Facing a potential surge on a surge, will the early vaccinations do anything to reduce the extent and duration of the spread? And will an extended surge impact vaccine distribution priorities?
I don't anticipate that, the 30,000 or so vaccines that we received are going to significantly impact the surge itself. What it has the potential to do is help us on the staffing side. So as we have hospital staff, our paramedics and first responders, increasingly immunized against COVID-19, our hope is that we're going to see less impact in terms of absenteeism associated with COVID-19. But it's the vaccine that we have at this stage is not going to be nearly enough to have any substantial impact on the numbers of new cases and hospitalizations.
And I'd like to add, as we see vaccine coming into our community, we're trying to strategically focus and adhere to the directives from the Centers for Disease Control and from the Department of State Health Services on how we apply that vaccine so that we can support those critical infrastructure pieces. But then also when we are able to focus on those highest risk populations, the long-term care facility residents, so that we can mitigate as much as possible the onset of complications from COVID-19 disease and deaths. It's going to take some time to have enough vaccine to cover enough of our community so that we achieve that herd immunity. So in the meantime, we have to continue practicing these important infection control measures while vaccine is rolling out and while we're being strategic about it, so that we can try to use all of these as tools to try to push the curve down and protect everyone.
This next question is from KVU. What tangible changes would Austinites notice if the city moves into stage 5 after the holidays?
Again, the majority of stage 5 would involve recommendations. In the past, stage 5 looked like a lockdown, but we think that stronger recommendations to folks, again, recommending that they stay home if they can, if they have to go out, only going out for essential things, working from home if that's an option, and transitioning their routine if they're going to go shopping or go to a restaurant to do takeaway and delivery only. It's something that folks can do now. It's something that we recommend folks who are at higher risk or have a household member who's at higher risk for COVID-19 severe disease to do now during stage 4. Again, if those recommendations don't result in decreasing activity, then we'll have to look at other options, and that would include a curfew to further reduce risk. Again, we know that these disastrous surges can happen. We've seen it happen over and over and over again in Texas and around the country. We cannot let it happen here, and that means looking at how we can reduce risk. Ultimately, what we need is people to wear their mask. We need people to distance. We do not see disease transmission in circumstances where both parties are masked and distanced. It's just not happening. Where is it happening? It's happening at dinner tables. It's happening at restaurants when people are seated with individuals who have COVID-19 and may not know it. We're seeing it happen at extracurricular activities. It is not happening in the circumstances where people are following the guidance. That's all we need to do. And if we do that now, if we make that commitment to do it for the next 2 or 3 weeks, we can flatten this curve dramatically, and we can put ourselves in a better situation going into the new year, and with the expectation of increasing numbers of vaccines.
This next question is our last question. It comes from patch.com. Given recent spikes, is the space at the Austin Convention Center still set up as a makeshift clinic?
The convention center is still set up as an alternate care site. Again, it's designed to take care of lower acuity patients, so individuals who may need supplementary oxygen, they may need minor care, not quite ready to go home yet. But again, our rate limiting step right now in terms of hospitals are the ICU capacity numbers. Those are much harder to create, and that's where our concern still is. Again, we expect that we could have 200 ICU beds available for a surge. We're about halfway there already. So there's not a lot of redundancy in ICU beds, and that's why we've got to work hard to decrease transmission, particularly in those circumstances where people are at high risk for severe disease.
Thank you.
Thank you, Ashley. Now we will move on to our closing remarks. Stephanie?
Just as a reminder, we really want you to be safe during this holiday season. Our hope is that you have decided exactly what you're going to do with your family, the individuals that live in your household. On our website, you will find some guidance that our staff have put together for you to think about from a low, medium, and high risk. Our hope is that you take the low risk suggestions and think about how you and your family can do those this holiday season. It is going to be important for you to continue to wear your mask, watch your face, watch your distance, and wash your hands. And also, if you're feeling ill or you've had exposure to an individual that may be COVID positive, or if they're in isolation, please reach out and have a test. It's going to be important for you to do that. We really need you to be patient during this time. We have been really excited about the vaccines that have come into our community and about providing those to that first group of individuals. But we still have a ways to go. So it's going to be important for you to continue those preventive health measures that we've put in place. Enjoy your holiday season, and please designate an individual that can go out and do your shopping for you and your family. Have safe holidays.
This Christmas season, it's important to remember that we are in a circumstance where there's significant risk in our community. And as we think about gift giving for Christmas, the best gift we can give to our family, to people we don't know, is the gift of life, the gift of health. And it's very simple for us to do that by wearing a mask, by social distancing, by staying home if we can. There are so many families right now in our community and across this country who are suffering because of COVID-19. It's really up to all of us to do the simple things we can, the simple acts that will be magnified by other people in the community doing the same thing. And with that, we can save many lives. We can save many families suffering, having people, loved ones in the hospital. So let's work together this Christmas season and ensure that we can give those gifts to people in our community.
And I'm just going to, again, talk about those things that are crucial. The 3 C's: cover your face, avoid confined spaces, and stay away from crowds. If you need to, if you ideally gather and have your holiday gatherings with those only in your household, and if you have family members outside of your household, refrain from that interaction. Again, if you do choose to gather, it's going to be very important for you to exercise some personal responsibility. If you choose to go somewhere and participate in a holiday activity, you need to be sure that you are covering your face, socially distancing, not attending if you're sick, and make sure you're washing your hands frequently and avoid touching your face. Again, we want to flatten the curve. It's going to take the entire community to engage in these prevention activities to minimize the risk. I will also reemphasize, if you do travel away, it's best to get tested now before you travel to make sure you haven't got COVID. But then when you return, you should get a viral test and self-quarantine for a full 7 days, avoiding any essential activities upon your return. And with that, I hope everyone has a very safe and happy holidays.
And finally, just want to talk about that we know we have hope. We have the vaccine on the horizon. But we also, as Dr. Escott talked about, our infection control measures work. They can protect us if we will use them. So masking is so important, hand washing, staying home when you're sick, and avoiding interactions with others as much as possible. This holiday season, I know it's hard. It's hard not to visit grandparents and parents and extended family and friends. But it's so critically important that we focus on thinking about everyone's health, your personal health, your family's health, those individuals in our family that are within that 65 and older category. How do we make sure we protect everyone so that for the holidays to come in the next years, we can all celebrate together safely and have everyone participating? With that, stay safe, Austin. Have a happy holiday.
That concludes our media availability for today. Thank you to APH Director Stephanie Hayden, Dr. Mark Escott, Chief Epidemiologist Janet Pichette, Cassandra De Leon, Interim APH Assistant Director, Disease Prevention Health Promotion Division, and to our pool reporter, Ashley Lopez from KUT for joining us today. Thank you and have a safe day.